strong.
Welcome back to my channel, Holistic Beauty RN. If you're new here, welcome. And if you're an OG, oldie but a goodie, welcome back. So, if you guys can't already tell by the title, the purpose of my video today is to do a day in the life of a family nurse practitioner. So FYI, I am a family nurse practitioner. So I'm going to kind of take you guys along with me just to kind of show you through the process of what I typically do at work as a nurse practitioner. So first and foremost, for those of you who may not know what a family nurse practitioner is. So a family nurse practitioner, it's an advanced practice registered nurse. So I do have to be licensed as a registered nurse, which I already am, in conjunction with doing your advanced practice registered nurse. So basically I had did my BSN or my Bachelor's of Science in Nursing, took my NCLEX to be licensed as a registered nurse, and then I went on an additional few years to complete my MSN or my Master's of Science in Nursing, and then I had to take an exam to be board certified as a family nurse practitioner. So that's my certifying body through ANCC, so that I can be board certified and register for my licensure as an advanced practice registered nurse. So unlike a registered nurse, an advanced practice registered nurse, as the title entails, works at a higher level. So it's not your typical registered nurse, it's a higher level nurse. So basically we are in the provider role. So basically we are doing the things that a medical doctor would do or a physician assistant would do. We're kind of in that level of a provider role. So basically, diagnosing disease process in patients, implementing a treatment plan, which may include prescribing medications and different things like that, assessing the patient, doing a physical exam, where we try to collect data and information to help formulate our diagnosis so that we can better treat that patient and essentially manage them depending on whatever condition that they may have. So that is basically just kind of a quick rundown of what an advanced practice registered nurse, aka family nurse practitioner, is. And just also FYI, there are different levels of advanced practice registered nurse. So aside from family nurse practitioners, you have like your nurse anesthetists that are a type of advanced practice registered nurse, a clinical nurse specialist. You have nurse managers sometimes, kind of depending on their roles. They may have a master's and kind of be in that level. But typically an advanced practice registered nurse would be any type of like nurse practitioner, whether it's through adult, pediatric nurse practitioner, mental health nurse practitioner, family nurse practitioner, which is what I am, or a nurse anesthetist. So those are different kind of roles of advanced practice registered nurse that fall in that category. So what do I do? So as a family nurse practitioner, I work at an immediate care, aka urgent care clinic. So I kind of describe this in my other videos. So I kind of go into a little bit more detail of what that is. So if you guys are interested in wondering what that is, or if you just kind of want to check out my latest video about 5 things to help get you through nurse practitioner school, go ahead and click on the link and you will see that. So see, I'm making it easier for you. I'm linking it above. But basically I work at an urgent care clinic. So what we do there is see patients who may not be in that emergent status, like what they would be in if they were to go to an emergency room, like for somebody having chest pain, or maybe they were in a motor vehicle collision or having broken bones, or maybe they're more critical, they're found unconscious. Patients like that, for instance, would be recommended to go to an emergency room if they're not already being taken by an ambulance there. But for somebody who is not in that emergent or critical condition, like say for instance they just get a laceration and need some sutures, or maybe they broke their ankle. I had a patient that came in for that the other day, or a sprained ankle, or maybe they got a burn, and they need treatment for that. So things that are a little less critical, they're not emergent situations, but if they can't for whatever reason get in their primary care provider's office right away, sometimes it's hard to get a same-day appointment, or they just need to get in real quickly, definitely an immediate care center where I work would definitely be the recommended choice for them at that point. So that is what I do. So basically, if you guys are wondering kind of how my day-to-day schedule goes, so basically I'm at the clinic for about 7 to 8 hours, give or take maybe an hour or two less, kind of depending on the needs of the clinic for that day. If there's like cancellations or add-ons or walk-ins, because also too with an emergent care clinic, patients can walk in at any time. So it just kind of depends on, what's going on in the day, which is kind of hard to tell until the day of, the time of. But basically, I like to get my day started going through my patient list, seeing how many patients I have at least for that time. Of course, all of that may change if we have add-ons, walk-ins. Of course, it's not going to be consistent throughout the day, but at least just so I can kind of get a basic rundown. This is how many patients I have, so it kind of gives me that mental state like, okay, this is what I have to prepare for. This is what the time looks like. This is how many patients I've had for now. These are what they're coming in for, all telehealth COVID. Oh, we've got a walk-in coming for UTI symptoms. So, I know to better mentally prepare myself for what's to come and to get whatever needed information I may need for the time being. I do telehealth visits, so a lot of patients that come in for COVID are getting swabbed. They are having symptoms, or maybe they're traveling or just returned from traveling, and their job wants kind of some confirmation that they didn't acquire COVID during their travel time, especially if they're coming from a high risk area that has been known to have a lot of COVID cases. Then employers would typically recommend that. I do a lot of telehealth visits with COVID patients where I would call them over the phone or do a video chat with them to kind of assess their symptoms and see what's going on with them, collect that information, just kind of get some brief medical background from them. And then obviously recommend a testing. So we do offer rapid tests, which they normally hear results within the hour. And then we also offer PCR tests, the polymerase chain reaction test. So that takes a little bit longer, but they are able to have at least those options, kind of depending on the needs of the patient, if they need those results right away versus if they can wait. And I know if they're traveling, a lot of international flights especially require the PCR test to be done over the rapid. So that is what I would do. I would do a lot of telehealth visits in the office, and then sometimes I'll have walk-in patients or patients that we call in and schedule an appointment, and then they'll be able to come in office, and I'll see, of course, ruling out COVID symptoms because, just for the safety of the staff and, any other patients that may come in, we want to eliminate that exposure risk. So obviously screen them for COVID at the door or even before they come in when they're calling in for their appointments, doing that, and then having them come in. But so that is basically what my job entails. So today I have the opportunity to work from home, which is kind of nice. You're in the comfort of your own home setting and you're able to still do the things that you need to do. So obviously for HIPAA reasons, I'm not going to really have you guys on the call with me, when I'm calling and screening my patients for COVID, but basically that's all I'm doing today. I'm working from home. I have my list and I have my computer right here. You guys are actually sitting on top of my computer resting. So I have my computer right here, which kind of gives me my patient list. So far I've got like at least 20 patients for the day. I've gotten through a good amount of them already. So I'll call the patient, basically go through a series of questions. So basically I have my little notepad here where I'm like writing down notes where I have for each patient, because then eventually I'm going to have to document this into the patient chart, which is so important. You don't want to leave out any information that's pertinent to the patient, especially what they're being seen for. So basically I would screen them and ask them, what are your symptoms today? So it would be through a whole list of symptoms with COVID. I ask about shortness of breath, difficulty breathing, any fevers or chills, any new loss of taste or smell, any nausea, vomiting or diarrhea, any cough, sore throat, congestion, runny nose. Did I leave anything out? And then headaches. So those are the things that I would definitely screen for. A lot of the times they'll just tell me, okay, here are my symptoms, and then I definitely want to know when they started. So through nursing school or F&P school, we've learned, especially when assessing the patient, we've learned the acronym, and maybe I can do a video on this one day. Different ideas to do videos on, but we've learned about the acronym OLD CARTS, so OLD-CARTS, so that kind of helps you make sure that you're collecting all the information about the chronic or whatever they're coming for, HPI, their history of presenting illness. So OLD CARTS would be O for onset, so when did these symptoms occur? L would be the location, where's the location of the symptom? If they're having a pain somewhere, what is that location? D would be the duration or the length of time. How long has it been going on? Has it been consistent or does it come and go? C would be the character of the pain, so especially if it's something more so along the line of, hey, I'm having pain, okay, what's the character? You know, um, does it feel like it's a burning, sharp, shooting, dull, achy type of thing? So that's what C is for. A would be for aggravating factors. So is there anything that makes these symptoms worse? And then alongside that would be R, would be relieving factors. Is there anything that makes the symptoms better? T is your temporal factor. So what other symptoms are going along with this? So along with these symptoms, are you having like any fever, chills, along with your back pain or whatever it is that we're assessing you for? And then S would be for severity. So are your symptoms severe enough to where you're missing work, school, or any other tasks that require your day-to-day attention? So that is the acronym that we follow when I'm trying to assess them for their symptoms, to kind of go through the list. So after I get that bit of information, then I'm going to get their past medical history. Are they currently being treated for any chronic illness at the time, like hypertension, diabetes, thyroid issues, depression, anxiety, etc. You always want to know the background to know what other factors come into play. And then I would ask them about, are they taking any current medications? Because obviously if they've got a chronic illness, 9 times out of 10 they're taking a medication with that. So you want to know what those medications are to document it in their chart, especially if they're a returning patient. So then you definitely want to know, obviously in that instant, what are their chronic conditions? What medications are they taking for their conditions? And then lastly, I want to know about their allergies. Are they allergic to any medications? This is good to know. Obviously, if you're prescribing antibiotics or any other medications, you always want to know what they're allergic to, because obviously if they're allergic to it, you don't want to prescribe it. You want to find a substitute that's going to still cure whatever they have or treat, help manage, but not something that they're going to develop a reaction to. So aside from that, then I would, once I've formulated my diagnosis, assess them, gotten all the information that I need to do, especially if it's during a telehealth visit, I'm not physically there to see them, so it's kind of harder to assess them in the sense where I'm listening to their heart, their lungs, things like that. So I would assess them through how do they sound? Are they coughing? If they're coughing, does it sound like there's production? Is it a productive cough? Are they able to cough it up? If I'm doing a video chat with them, if they cough, maybe I want to see the sputum. Show me in the camera, what does it look like? What color is it? Or they could just describe to me what it looks like. So once I've gathered my data, I can better diagnose them to see, okay, well, now at this point, I definitely recommend you get a test, a COVID test. And if it is related to COVID, so I would recommend that, hey, you can try this symptom management treatment, because basically with COVID, it's a virus, right? There's no cure, so it's just basically symptom management. So I would recommend things based off of all the other information that I have. Well, here, this is the best treatment plan for you. Maybe you can try an over-the-counter acetaminophen for your headache. Maybe we'll start you off at 500 milligrams every 4 to 6 hours as needed, because you have this headache, and we don't want you to sit there and suffer. If they're having a lot of diarrhea or nausea, maybe I will implement a clear liquid diet for the first 12 to 24 hours to kind of rest their stomach a little bit. Make sure you throw some Gatorade in there to replenish and get that electrolytes that you need, that you may be losing through the diarrhea. So there's different things like that that I will assess along the way. So this is basically what I'm doing. And then I do my documentation, which is so important, because as they say with nursing, if you guys don't already know, if you didn't chart it, it didn't happen. So it's very imperative to write down everything that you've done, you've said, you've assessed, so that if it comes back, it won't come back to bite you in the butt. So that is my day. I hope you guys like this day in the life video. If you guys enjoy videos like this and kind of maybe want to see more videos like this, definitely give this video a thumbs up. Comment down below if you have any questions, comments, concerns, whatever the case may be. I'm always here and eager to help. And I hope to see you guys in my next video. My next video, I'll talk about the differences between differential diagnosis, how to kind of come up with a differential diagnosis, just kind of explain the process of that, and maybe even kind of show you guys how I chart, just kind of, how to stay organized through the charting process so I don't forget information. So stay tuned for that video next, and I will see you guys in my next one. Until then, peace, love, and happiness. Bye-bye. Be strong. Be strong.